My name is Derek Houston. I am the CEO of the Market at 25th, which is a community grocery store in the east end of Richmond, Virginia. Well, I think that food is at the core of humanity. It is that basic need. It's something that we think about every day. It's something that we find joy through and connection to others. We share meals, we gather around food. Um, I think that's why it's such a great way to approach a community. And it's, you know, on the workforce level, the grocery store plays a really important role in that it's a very complex environment, but there are jobs in a grocery store that are actually entry level. Like this is something that's I think, a really big challenge right now of uh, where's somewhere that you can walk into without experience and get experience as a young person entering the workforce. Grocery store is still one of those places. Steve Markel uh, decided that he was going to make a big move to invest in a lot of ways in the East End, and uh, had a lot of conversations, asked what was needed in the neighborhood, and one of the things that was repeatedly said was a full service grocery store. So the area had been without one. It was a food desert for over a decade, and um, the decision was made based on that to create a grocery store and a number of things around it. Some other anchor institutions, um, and it went into sort of more listening, asking, what in particular, what should be in this grocery store. All foods, but in particular, healthy foods. The area it was a food desert, but people were eating. They were just getting their food, largely from convenience stores, corner stores that didn't necessarily have, fresh produce and other healthy options. So, one of the most important things that we have is our produce department. We're in a qualifying area for this program that provides free meals to um, in our store. We don't do infants. That's from one years old to 18 years old. We're serving lunches. The program has many different versions and different sites. But for us, we do lunches Monday through Friday. Feedmore actually provides the food; they deliver it to us, and so we serve as a site for uh, children to be able to come and eat the meals. It was an important opportunity for us to seize because a lot of families depend on school meals throughout the school year, and the need that the school meals are serving doesn't go away in the summer. So it's often not answered. This is a great answer to that. And because we're a place where, all people come, we wanted to be a site where people, parents could come and bring their kids, needing to do grocery shopping anyway, so their kids could have a meal while they're shopping. It was kind of a no-brainer to offer ourselves as a site for that. So it's important kind of on two levels. One is that it is these are the funds that people have available, our customers have available to purchase what we sell. So, our goal is to get healthy food into people's stomachs, and that has to happen through a purchase. And so, just meeting their need in the way that they are able to. And then on the other side, for us as a business, a grocery store takes uh, it's necessarily a large operation to have all of those departments. It has high fixed costs, requires large volume of sales, and so even if we weren't, you know, existing for the purpose of creating food access uh, for people for whom that was a challenge previously, it would still be something that for us accepting SNAP is just money to the not directly to the bottom line, but it is a important part of a big chunk of our revenue. Well, it's like I said, it's a big portion of our revenue. It has a flow over the course of the month. Most people who receive SNAP funds tend to use uh, a large portion of it on receiving it. They have the immediate need and seek to satisfy that then. So uh, in our area, we know the dates that people receive the funds. Those are the days that of the entire month that are busiest for us. Um, so and the week that first week of the month, we're really able to see, watching our cash flow because we're mission oriented. Uh, and not in a location that is chosen based on profit in an industry that already has really slim margins. Um, we can see a big difference in our cash flow between that first month when people's SNAP funds are spending those large amounts. Um, and it's almost like if that could happen for the entire month, like that would be our ideal, but seizing it when it's available is really important for the sustainability, the financial sustainability of our company. A 10% drop in SNAP spending in our store doesn't mean 10% reduction in profitability. It could mean significantly more than that. And it's not necessarily just people having less money to spend. Like, it's not just a correlation to how much less there is to spend or how many fewer people have that money to spend. It's also there are decisions in it. Whenever things tighten up, uh, people make a choice of the goal for someone with a fixed income is, how do I get this money to meet the need to, you know, how do I get enough food with this? And sometimes that answer switches from, I'm going to go to my community grocery store. Well, we're not the cheapest source of food. We don't have the scale that allows us, we don't control our whole supply chain the way that chains do. So there's often a switch to, you know, dollar stores, discount stores. And it's, the whole customer is lost in that case. They take their whole basket to a Walmart who's able to, demand the lowest possible costs and provide the lowest possible prices. It's a public health issue, and we have a good understanding of the role that diet plays in that. Um, when people have less money, another thing that they do differently is they decide, we have a definition of what enough means, and a caloric need is a part of that. So uh, we see shifts from, away from buying produce. Um, the thinking about particular nutrients, micronutrients, is when you're concerned about getting enough food, that feels like a luxury, but we know that it's not optional for living a healthy life. Um, I don't think I don't think the community really knows what's coming with the cuts and how it's going to affect them. We came into our neighborhood, wanted to provide this store thinking, it was a food desert. There wasn't one available. And we didn't fully understand the difficulty that would come with, or the time it would take to change habits around where people were getting their food from, because they had been doing it for years, and what types of foods they were purchasing. Making produce available didn't mean that it instantly, became the right portion of people's diets. And I'm saying that to say that in something like this, thinking about the families, you know, having meals, children growing up with, certain ideas of what it looks like to have a meal, to nourish oneself, um, doing that with limitations that preclude choices that really contribute to long-term health, that forms long-term behavioral patterns. And it's such a hard thing to change. We've had some programs that have actually done a good job of that, of incentivizing the purchase of produce. Actually giving an economic incentive by making it more affordable. Uh, Seeing how hard that's been to do and how long it's taken, but that has been successful. And to see something that's going to run counter to that, that's going to more deeply entrench, uh, through the struggle of getting food, through the struggle that comes from choices like, how do I get enough? I feel like my hope is that, these cuts are in some way reversed, that we actually get better as a nation at providing for basic needs like food. But I feel like we'll be counting the years between now and when we achieve that. And with every passing year, we'll be, um, building the wrong habits for people. I'd like for us to, find how having a better relationship with food gives us an opportunity to have a better relationship with our communities and with each other.